Okay, I think we'll get started. Good morning, good afternoon, wherever you are. Thank you so much for joining this lecture series. Welcome to the Heart Health Lecture Series, and thank you for joining us. Next slide. My name is Dr. Dennis Goodman. I'm a clinical professor in the Department of Medicine and Director of Integrated Medicine at the Leon Charney Division of Cardiology for the Prevention of Cardiovascular Disease. And I am the founder of this series with significant help from Julia Levin and Anya Coates, and I'm so grateful for their help. And while I'm giving gratitude, I want to thank you, Michelle Liu, for helping us to do this webinar. There's a lot of logistics that go on, and we appreciate your help. Next slide. So many of you are regulars on the series, and we really appreciate you figuring out how to get onto these programs on the internet. It's not that easy. I think we're getting it down now. And if you have any issues or problems, please be in touch with us, and we'll help you to make this happen. This year, coming up, as you know, I'm constantly thinking about topics. Please let us know. You can be in touch with Anya. We'll give you the address in a minute, the email address. I'm planning on doing meditation, stress, and your health, a women's health update next year in February for Women's Health Month, and seasonal nutrition eating patterns. So stay tuned. We'll very shortly be giving you the dates. Next slide. So this is an important slide for you. Please write this down. This is our website, and you can see it there. That's our email. We also have a Twitter feed. And it's important to know that if you go onto our website, you can actually, there's a link to YouTube and a lot of our previous lectures, in fact, many of them that were recorded. So you can always go back if you miss one or you'd like to hear one again. They're there on YouTube, and you can listen to them at your convenience. Next slide. So many of the past topics are here. I always feel good when I show this slide. We've covered so many topics. I'm not going to go through them now. But it's important to know that I'm constantly thinking about topics that will be helpful to you. Please don't hesitate to be in touch with us. Let us know what you'd like us to talk about. We have an incredible number of experts at NYU and all over the country that can help us with this. So please be in touch with us, and I'll make it happen. Next slide. More topics. Next slide. So this is just to tell you that if you have a question, there's a chat feature. You can see it. It should be on your screen in front of you. You can enter your question at the bottom there at any time during these these talks. I'm going to field the questions, and I'm going to be the moderator at the end in about 40 minutes from now, and I'll take your questions. I've also received several questions by email, and we'll cover those as well. So we encourage you to ask questions. Try to keep it short, and we'll try to get to all the questions. Next slide. So it's my great pleasure today to bring you two absolute experts. The topic is heart disease, inflammation, and exercise. I know about 2 weeks ago, I spoke about the immune system and how you can boost the immune system during a pandemic. And I didn't get into the details on exercise because I knew we'd be talking about it today. I want to thank both my speakers. I'm going to introduce Dr. Sokolov to you in about 15, 20 minutes. But at this moment, I want to introduce Dr. Heffron, who is a colleague, he's a friend, he is a frequent guest. I wouldn't call him a guest, he's actually a frequent participant on my lecture series and many of my conferences. Sean, I really appreciate you're a busy man. I want to say a few things about you. You're a rising rock star at NYU, and I'm so privileged to have the ability to work with you and to be in the same department as you. Dr. Heffron's an assistant professor in the Department of Medicine at NYU Grossman School of Medicine. He did his medical training and Masters of Nutrition and Exercise. He's a preventative cardiologist in our prevention center, and he encourages optimal nutrition and regular physical activity as a way to prevent and manage obesity, which, as you know, can adversely affect a person's cardiovascular disease risk. Dr. Heffron offers consultative services. In other words, he sees patients in his office. I'm going to give you this number, which is 212-263-0855, which is the number to call if you'd like to see him. He sees patients in the office. Dr. Heffron He's doing a lot of research into the ramifications of obesity on cardiovascular health. He studies how cardiovascular disease risk factors are altered after bariatric surgery, which is surgery for obesity. His research is funded by the NIH, the American Heart Association, the American Medical Association, and the NYU HAC Clinical and Translational Science Institute. In other words, he's a major researcher. He's just been granted a major award. And Dr. Heffron, it's a real pleasure to have you back. Thank you for coming to educate us and to be part of this series. I'll hand it over to you.
All right. Thank you, Dennis, for the introduction and for the invitation. It's always a pleasure to speak in this forum. Next slide. So as you saw with my title slide, I'm going to be specifically speaking today about the ramifications of inflammation on cardiovascular disease, as I'm a cardiologist and that's my area of expertise. And you know, the topic of this conversation overall is immune function, and I guess whether you know it or not, inflammation is caused and mediated by immune cells, and so that's why this is inflammation and cardiovascular disease are relevant in this situation. And the lack of exercise certainly can contribute to that. The participating in exercise can help combat that, and that's what I'll speak about today. None of this concept, though, that I'll talk about the benefits of exercise is novel by any means. This is a quote that I often start most of my talks about exercise with from Hippocrates, kind of the father of medicine, thousands of years ago, noted that all parts of the body which have a function, if used in moderation and exercised in labors in which each is accustomed, become thereby healthy, well-developed, and age more slowly, but if unused and left idle, they become liable to disease, defective, and growth, and age quickly. And part of the contributing factors that we now know to the disease and defective and growth, quick aging associated with lack of exercise is due to hyperactivity of the immune system and inflammation, which I'll speak about. Next slide. Yeah, so inflammation is kind of the broad topic, but I'm going to be speaking specifically about vascular inflammation, the inflammation of the blood vessels. Next slide. Just a kind of a basic concept to what is inflammation. I'm sure it's something that you've all heard of, but what is it exactly? So kind of the concept of the process of inflammation is represented by this kind of relatively simplistic figure. I tried to find the simplest figure of inflammation I could, in that it's mediated by immune cells through this kind of stereotypical process represented here. We have someone getting jabbed with a pin, getting a sliver, and breaking the protective barrier of the skin, introducing a pathogen labeled here, so maybe a bacteria, through that barrier, and that breaking of the skin, the presence of the bacteria results in the release of chemicals that are active, labeled histamine here, and this results in the recruitment of immune cells that come to respond to this breaking of the protective barrier and to the introduction of a pathogen to try to deal with it. And that's the purpose of these cells. Here we have phagocytic cells, maybe neutrophils, and a macrophage there within the tissue. And you can see that kind of by the end, the immune cells are dealing with the pathogen and are taking care of it. And that's what we hope that our immune system does. That's the overall purpose of it. And next slide. However, there are situations in which an overactive immune system or kind of a dysfunctional immune system can be problematic. And not to say that a dysfunctional immune system exists in anyone with atherosclerosis, it's so widespread, but it is the result of the activation of the immune system and the causing of inflammation that actually causes this process. The LDL cholesterol, the bad cholesterol that we have floating around in our blood vessels, if it breaks through the protective barrier on the inside of the blood vessel, the endothelial cells, then it's treated somewhat like a pathogen. And when that happens, then you get the infiltration of macrophages, those immune cells that come and take up that cholesterol, and you get, in the end, the formation of an atherosclerotic plaque. And it's the formation of these plaques that, if left unabated, can cause angina, or if they're left unabated and they become unstable, can rupture and cause a heart attack or a stroke. And that happens through the process kind of represented on this figure here, in which you have macrophages that become foam cells that are stuck in the plaque. They end up dying, and then you get the release of some of these chemicals or chemokines, we say, cytokines on the right, IL-8, IL-1 beta, TNF-alpha, which may or may not be familiar to you, but certainly in the medical field, these are known as pro-inflammatory mediators, things that cause inflammation not only of the blood vessel, but the body systemically. Next slide. So how does physical inactivity or exercise, or the lack of that, contribute to this condition? Well, I've tried to lay that out in a stepwise fashion here. Next slide. So when someone doesn't participate in exercise, they're prone to an accumulation of fat around the middle. And this may occur in people who aren't even that really overweight. When you're not exercising, the body isn't going through a process that leads to the use of extra fat tissue, and it tends to store it around the middle, which is actually that we've known, but we don't exactly know why, that this contributes to a pro-inflammatory state. Next slide. And this is manifest by the infiltration of macrophages, these immune cells that you've seen on a number of slides that I've shown, that come into the fat and start to release inflammatory mediators that are circulated throughout the body and go throughout the body within the blood cells, within the arteries that are supplying blood to the heart and the rest of the body. Next slide. And this inflammatory milieu, the infiltration of these macrophages in the visceral fat, leads to a setting of chronic systemic and vascular inflammation. And this isn't to say that this is such severe inflammation like the burning individual I showed in the early slide, or a red, excuse me, a red finger that you may get from just recently, cutting yourself or getting an infection. But this is a relatively low-grade, systemic but chronic, unrelenting level of inflammation. Next slide. And this results in the activation of immune cells, like we've seen on the previous slides, that can then go to the blood vessels. If there's LDL present, they can start to form atherosclerotic plaques, release cytokines, potentially make those atherosclerotic plaques unstable, but then further propagate this kind of cyclical process, and that worsens and worsens. Next slide. Similarly, they can have inflammatory effects on cells like the muscle or on the liver that can contribute to insulin resistance and lead to the development of type 2 diabetes, which worsens people's risk for atherosclerosis, and likewise propagates this cycle that just continues to worsen and worsen if there's no break in the cycle. Next slide. These are by no means the only negative impacts of this lack of physical activity resulting from chronic inflammation. They just happen to be the two areas that I'm most familiar with. Certainly there are other areas such as dementia and Alzheimer's disease, sarcopenia, and many other conditions, but we'll speak about heart disease today. Next slide. So how can exercise then counter the inflammation that may be present and driving atherosclerosis? Next slide. One mechanism for that is countering the buildup of that inflammatory visceral adipose, visceral fat tissue. You can see in this slide here, the green bars are visceral fat, and when individuals participate in any type of physical activity, be it resistance, aerobic exercise, or a combination, they see marked reductions in that amount of visceral fat and accordingly reductions in systemic and vascular inflammation. Next slide. Furthermore, through mechanisms that I'm not going to get into today, the actual contraction of the muscle tends to release, the contraction of the muscle releases cytokines that have anti-inflammatory capacity, act on the adipose tissue, act on the blood vessels themselves through the endothelial cells, making them less reactive, and then have impacts on immune cells through processes that Dr. Sokolov will speak about a little bit more later. And this all results in a reduction of systemic and vascular inflammation. Next slide. So to kind of translate this back to the plaque that we looked at earlier, when you participate in exercise through a great number of slightly and less well understood mechanisms, the physical contractions of the muscle, the changes in your overall body composition, reductions in visceral adipose tissue help counteract the inflammation within the plaque. So next slide. You get reductions in these inflammatory mediators that destabilize the plaque and cause the systemic inflammation present throughout the body. Next slide. You get improved efferocytosis, meaning the cells that are within the plaque tend to deal with dying cells within it better to clean up the mess and help get rid of the plaque. Next slide. You actually bring in anti-inflammatory macrophages. So macrophages are a very complicated cell type, and they initially come in and are inflammatory to deal with pathogens, but afterwards you need anti-inflammatory ones to come in and clean up the mess. However, in plaques and in systemic and chronic inflammation, you tend to have a greater amount of the inflammatory ones, but exercise tends to weigh that balance the other way. So you have a majority of anti-inflammatory macrophages that do good things. Next slide. And this translates to a reduction in the propagation of the overall plaque, better health of the cells within it, and an overall stability of a plaque. Next slide. And the actual resolution of inflammation, both at a local level, which we really care about, from a plaque standpoint. We want it to not be inflamed and potentially pop open, rupture, contribute to a heart attack or a stroke, but on a systemic basis as well that calms down the entire cycle and acts to break those cycles that I spoke about earlier that contribute to atherosclerosis, type 2 diabetes, dementia, et cetera, all associated with chronic systemic inflammation stemming from a sedentary lifestyle. Next slide. And so this is one of the ways in which exercise helps reduce the risk of heart and vascular disease. Certainly, it's by no means the only one, but it's the one that we're focused on today. Nonetheless, it's a big contributor, and I always like to, in my talks, kind of focusing on this figure in which we see physical activity volume on the x-axis on the bottom and cardiovascular risk on the y on the left. And, you know, the vast majority of Americans are pretty close to the origin here, way far over on the left, participating in little physical activity, and that places them at increased cardiovascular risk. However, when you start participate to any degree in physical activity, you start to see potential marked reductions in individuals' cardiovascular risk. And the American Heart Association recommends, of course, a minimum of 150 minutes per week of moderate intensity physical activity. So that's about 30 minutes a day at a minimum. And that has been shown, the reason we recommend that as a minimum is because that's been shown repeatedly to potentially nearly halve an individual's cardiovascular risk. But certainly when you exceed that minimum and continue to participate in increasing amounts of physical activity, then you see the continued reduction in cardiovascular risk. And one major reason for that is the associated reduction of systemic inflammation that's mediated by immune system hyperactivity. Next slide. And so That's why whenever I counsel my patients on how we're going to treat and prevent atherosclerosis, I key on three things. I tell them we need a three-legged stool to stand on. Next slide. We need good medications for many of them, especially those that have already gone on to develop atherosclerosis or have a heart attack or a stroke. Next slide. We need a good diet to complement that, certainly. Next slide. And then we need to participate in physical activity because of the anti-inflammatory effects as well as all the other effects that I didn't have time to speak about today. And so with that, I thank you for your attention on this very kind of vascular-focused discussion of the immune effects of exercise. And I'm going to turn it over to Jonas, Dr. Sokolov, to discuss some of the other immune effects.
Oh, hi, thank you very
Hi,
much.
Jonas, hold on one second. Is Dr. Goodman here? I just want to introduce you to our audience. Dr. Sokolov is a clinical associate professor in the Department of Rehab Medicine at NYU Grossman School of Medicine, and he directs the Oncological Rehab, which is the cancer rehab program. Dr. Sokolov is a physician specializing in physical medicine and rehab. As a physiatrist, Dr. Sokolov's goal is to help patients regain function through treatments including rehab, injections for spine and joint pain, and medication. And he focuses on the rehab needs of cancer patients and survivors. Dr. Sokolov favors a more holistic approach to patient care wherever possible, trying to avoid prescription medications for long-term use. And I second that wholly. He's also certified in sports medicine with experience in treating sports-related injuries in cancer survivors and helping them return to sports and exercise routines. He's passionate about lifestyle interventions such as diet, exercise, stress reduction, and smoking to treat and prevent various chronic conditions and improve function. His research explores lifestyle interventions to improve the lives of people who have had cancer. He speaks at the local and national level about rehab programs for people with cancer. It's a pleasure to have you on and to join our team. Thank you very much, and we look forward to your talk.
Oh, thank you very much, Dr. Goodman. It is an absolute honor and pleasure to be with you all here today. I'm just going to dive right in. Next slide, please. Okay, so if there's one major point that I would like to get across to you all today, and that is exercise is absolutely 100% medicine. It has been said that there is nothing that comes closer to a so-called magic bullet as far as compared to exercise in terms of its universal effects on every single organ system. As Dr. Heffron was mentioning, particularly with cardiovascular disease, cancer, just overall inflammation, and inflammation being a very integral part of all disease, all chronic diseases, which is a big problem in our modern day society, whether it's cerebral vascular disease or cardiovascular disease or cancer. We know that the studies that have been done in the past, next slide, please, there has been sort of this myth, mainly in the 80s and 90s, that exercise, perhaps exercising too vigorously, could make one more susceptible to developing infection and help. It actually might impair immune function. We actually know that this is actually not the case when new, more robust studies have been done. Next slide, please, in the past 10 years or so. So we know that higher physical activity levels are definitely associated with lower incidence of self-reported upper respiratory tract infections, or URTIs, the abbreviation there. We know actually even in our endurance athletes, total training hours seems to be this inverse relationship with sick days or days missed from work or school, for example. Next slide, please. We know that some of the evidence regarding that exercise may lead to heightened infection is really, the data prior to up until about 10 years ago really has been quite poor. That some of the symptoms that are of an upper respiratory tract infection sometimes can occur with exercising vigorously, but that doesn't necessarily mean that these symptoms are actually are infectious in nature. A lot of the data was more subjective, really self-reported symptoms. When they went back and they did more rigorous studies, and they actually looked at immune function, looked at blood testing and cell counts, for example, they actually found the opposite. Next slide, please. So an antibody that is one of the first-line defenses that we have in our mucosal membranes, in our mouth, our throat, for example, our nose, right? It's our first-line defense, right? Aerosolized or pathogens, bugs. This would be IgA. It's an antibody. There has been some evidence that there may be some decline initially after a vigorous bout of exercise, but these levels return to normal levels within 24 hours. Next slide, please. And there may be adaptive reasons why this has occurred. When we look at another important immune cell known as a lymphocyte, we know that vigorous aerobic exercise, or cardiovascular exercise, or cardio is what more commonly referred to, we tend to see an increase in these lymphocytes, these very important immunological cells. We know that exercise actually can be a stimulus for the production of these cells. And we know that the functional capacity, the ability of these cells to react actually is enhanced by exercise. Next slide, please. And studies have shown that we can actually have an influx of these very important types of lymphocyte cells known as natural killer cells. Now, these cells are near and dear to my heart, working mainly in the oncology population and cancer population. The natural killer cells are very much involved in killing tumor cells, for example. So we actually see an increase in these cells during exercise. Some of this may be triggered by the increase in adrenaline and other hormones that are exhibited with a little bit of stress from an exercise bout, for example, is a stimulus to help ignite the production and release of a lot of these natural killer cells. We know that the response of the proliferation of these cells is actually dependent on the actual intensity of the exercise itself. Next slide, please. You can see a transient, a temporary decrease in some lymphocyte production, but there's actually a really good reason for this. So sometimes in some studies we have noticed that with vigorous exercise, we can actually get a decrease in the amount of circulating lymphocytes in the blood. Next slide, please. The reason for this would be that what's happening here is that those lymphocytes are actually being redeployed in response to a natural stress such as would occur during an exercise bout. Those lymphocytes are stimulated to be released by the body, but then they go out to the periphery and they start working on cells, for example, and they start kind of cleaning up all the garbage, I guess, in the body, you could think of it, the cells that are precancerous or even cancerous cells, and they work to destroy those cells. What they also do is they're going out and they're being triggered. There's a trigger that causes those cells to kind of be recycled, a process known as apoptosis. And that's a very important process because we need this constant recycling of these immune cells. We need to have new, more younger immune cells in the blood circulating so that we can actually have a more effective immune response. Next slide, please. We know that exercise absolutely has an anti-cancer effect. There is robust evidence that shows that exercise is preventative for at least 6 different types of cancers, and that if you exercise before you were diagnosed with breast, prostate, or colon cancer, your chances of surviving the disease go up significantly. If you start exercising after a diagnosis of certain types of cancers, also your chances of survival go up. Not only that, but exercising after a cancer diagnosis helps mitigate a lot of the side effects from cancer treatment. It helps improve overall quality of life, anxiety, depression. Next slide, please. Exercise, as far as affecting the body's ability to detect infection, is absolutely enhances the body's immune response with lymphocytes that are circulating. Next slide, please. We look at the effects. One of the reasons why we know this is that through a lot of clinical studies that have been done with vaccination, know, for example, there was a study where participants, women 55 to 75 years of age, who had a bout of exercise of moderate intensity immediately before a vaccination, showed a greater, significantly improved response to the vaccination if they actually exercise. So we know that there's an enhancement of this immune response, particularly with vaccination, with exercise. Next slide, please. The frequency of exercise in regards to enhancement of vaccination actually seems to go up with the duration and intensity of activity. For example, if somebody's exercising vigorously, and the way we characterize vigorous was something called the talk test. We tell patients, if you're exercising to the point where your heart rate is elevated and your respiratory rate is elevated to the point where you cannot talk, that would be considered vigorous activity. Moderate would be that you could still talk, have a conversation, but not be able to sing a song. So if you're looking at vigorous exercise, and our vigorous compared to our moderate, we actually see an enhanced effect with the greater intensity of exercise on this response to vaccination and immune response to vaccination. Next slide, please. And this carries over even some of the studies that have been observed in animal models, for example, in mice that have been inoculated with influenza intranasally. If they exercise before this and after this inoculation, they actually had a higher survival rate compared to the ones that did not. Next slide, please. But does aging, as we get older, does that have any bearing on this effect of exercise, this beneficial effects of exercise? Do we see a decline in the response? Well, we do see a decline overall as we age in our immune response, but there are no studies that report impaired immune competency from increased exercise. It does not negate the immunological benefits that we can get from exercise, and that frequent exercise across the whole lifespan tends to have benefits across any age. So absolutely, exercise still has this effect as we're aging. Next slide, please. There's a lot of sort of theories on why this is so, why exercise throughout the entire lifespan seems to have a beneficial effect. And mostly what it can be kind of simplified to is this balance effect. Next slide, please. So the immune system is always in a state of balance. We have these cells called T cells and we have B cells. Our T cells are our cells that are activated and they are able to form a memory of previous infections, and that when similar infections or invaders come into the body, those cells can be triggered and they can immediately flood to those invaders and destroy them. Next slide, please. But we always have to have this balance between the memory cells, or the memory of the immune system, plus and also with the new or the naive T cells. And we know that as we age, and Dr. Heffron was mentioning inflammation in his talk, we tend to see an increase in inflammation as we age, a process that's known as inflammaging. So next slide, please. And in the aging immune system, we tend to see an increase in these memory T cells. And memory T cells, again, are the ones that are most reactive. They're the ones that have already had some exposure to these invaders. And when they see another invader come along, they immediately flock to the invader and they try to kill it by releasing inflammatory mediators. That's sort of the tool or the way that the immune system is able to attack foreign invaders. So as we age, we tend to see a greater number of these T cells and a decrease in the newer, more sort of younger, what we call naive T cells. Again, we need to have this balance between the two. We can't have too much of one or the other. If we have too many memory T cells, then we may be more susceptible to inflammation, more reactive. Next slide, please. So what we notice is that in the endurance athlete population, for example, these athletes that are doing ultra marathons and ultra endurance races that sometimes last for days and hours on end, they also tend to get an increase in these memory T cells, and they have less number of these naive T cells. So again, their immune system tends to be out of balance, and it tends to kind of almost speed up the aging process. Next slide, please. However, if we exercise more sort of at levels that are considered to be recommended, we can actually get a diminution of the memory T cells and an increase in our naive T cells. And this, again, puts the immune system back into balance. Next slide, please. So we know that older adults, for example, there was a study done in older adults from ages 55 to 79 had a high level of leisurely cycling throughout life. And they compared this group to 75 age-matched controls. And the ones that were cycling had a better balance of these memory T cells and naive T cells. So they had fewer memory T cells circulating, which meant that their immune system essentially didn't age as much as their counterparts who did not exercise to the same degree. So we know that absolutely exercising in moderate intensities and exercising to what's considered recommended levels and not overdoing it certainly has a positive effect on helping to slow down the aging process, particularly as it relates to the immune system. Next slide, please. Next slide, please. Okay, so another reason why exercise helps to slow down the aging process is that it helps to decrease the amount of adipose tissue or fatty tissue in the body. We know that fatty tissue in the body is a promoter or stimulus for inflammation. It also helps lower the number or improve on obesity rate, for example. And obesity being, again, a strong risk factor for inflammation and chronic disease. It also has been shown to help improve just the overall aging of these T cells or these immune cells, lymphocytes and leukocytes, with increasing telomere length. So telomere you can think of holds genetic material together. Sometimes people use the analogy of the plastic tip of your shoelace. It kind of holds the shoelace together. Kind of same concept with genetic material. The longer that these telomeres are, is correlates to aging. So the longer is considered to be more robust and less aging. So exercise, again, decreases the level of fat, not only in our peripheral body around our midsection, but also around our organs. And again, having strong implications with inflammation. Next slide, please. Exercise helps, again, to expand the role of these memory T cells. It helps rebalance the system. It also helps reduce viral reactivation. And another reason why, as we age, some of these memory T cells tend to be more proliferative, tend to be greater in number, is that they're constantly being reactivated by viruses that may be latent in the body and then become active. So what exercise does is it actually prevents the reactivation of some of these viruses. So that's another way that exercise helps restore balance. Next slide. And so just to summarize, that there's really strong evidence that supports exercise as a frequent exercise enhancing immune competency. Vaccination studies that absolutely show that exercise helps augment the effect and help improve the response to an exercise, the chance that the vaccination is actually going to work. Again, this is particularly important in the elderly population, where vaccines often have to have dose adjustments, stronger doses or higher doses to get the same desired effect, let's say, you would get in a younger person. Exercise can actually enhance that effect and improve the chance that the vaccination would work, right? Very relevant to this day and age. It limits, exercise limits and delays the aging process of the immune system. And it helps improve immune competency across the entire lifespan. Again, exercise is medicine. Next slide. And that brings me to the end. Thank you.
So, wow, thank you both. Those were two outstanding lectures, a ton of information. I'm really happy that both of you focused a lot on the science, because we can tell patients all day long that exercise is good, but really you've both shown us how there's so much science behind all this. One thing I wanted to add, which neither of you mentioned, but is obvious, is that one of the reasons that exercise is so beneficial is it makes you feel better. And if you get into what I call this healthy habit of exercising, whether it's every morning, you just have a better day. And I think that whole aspect of the endorphins, which you can both comment on in a minute, is an absolute crucial part of the benefits of exercise. And it really helps you with, to me, it's one of the best ways for stress management. I've got a lot of questions, and I know, Dr. Heffron, you may have to leave a little early, but I really would like to get through many of these. And I want to start off with some of the questions that were emailed in. And the question here is, what are some of the best body indoor workouts for the winter months that doesn't require weights to stay in shape? And of course, what people are getting at here is, when it's freezing outside, if you're in the Northeast, what do you tell patients? And I think we should focus on the fact that not everybody, can get on a treadmill. They may be limited. So how do you suggest that people exercise when you have to be indoors? And you can both answer that, but I'll start with that one.
Maybe I'll chime in. I mean, I guess I'll be honest, I've been counseling my patients on how to exercise indoors for the last 8 months, regardless of even though the weather has been pretty nice recently. And, very few of them, certainly in New York City, have treadmills and whatnot. I myself have resorted to a lot more indoor exercise than before. And I've honestly adapted, by use of the internet largely. There are all sorts of, online, interactive and non-interactive aerobic type of exercises, which, for staying in shape, it's, when we think about cardiovascular fitness, it's aerobic type exercise that gets your heart rate up and sustained up that we're talking about. And a lot of, so there are lots of videos certainly for all levels of fitness and experience, and for levels of available equipment on the internet, many for free, but also there are, gyms and fitness centers have adapted over the last 8 months. And, we, prior to the pandemic, had a partnership with the 14th Street Y, in which my patients who were interested in specific exercise prescriptions and training went down to the 14th Street Y to get hands-on personal assistance. But since the pandemic's arisen, they now have virtual memberships and virtual training, virtual classes that they tell me actually get greater attendance than their in-person ones. We don't know exactly why, but it may be the fact that, people aren't as, maybe embarrassed, encumbered as if they were in a class full of their peers or whoever they perceive as being their peers, et cetera. So there are a lot of options out there for staying fit at home.
So I think one of the things that you're saying is you can actually just get in touch with a local, gym near you. And a lot of times they're signing you up to do their programs and to do their, their exercise sessions online. And so that's one way to start, just to get in touch with one of the programs that are near you, and they can set you up if you want to do it that way. Do you want to weigh in quickly, Dr. Sokolov, and then I've got some questions for you.
Yeah, we were having some discussion earlier. I mean, really, the best exercise to do is the one that you'll actually do. So, I know that for many of my patients indoors, and if they have limited space, for example, if they might not have a home gym or may not have space for that, things like dancing, just like Zumba, which a lot of classes can be available online or through video, DVD, and so forth, are a great way to get that heart rate and respiratory rate up and have fun. There's a lot of different, ways you can do that, but it really comes down to what is it that you would enjoy.
Okay, great answer. So there's a question from somebody that's 66 years old who's been sedentary. They want to start exercising. So both of you, I'd like you to weigh in about what would you suggest to that person? Should they talk to their doctor? The last thing you want is someone to overdo it and have a cardiovascular problem because they've been sedentary. So if you're asymptomatic and you want to start exercising, how would you go about that? Let's assume you're over 65. You start walking. Should you see your physician first? Should you get an exercise program for yourself? What do you think, Dr. Heffron?
Yeah, I'll answer this quickly, and then I'm going to have to take off, unfortunately. But certainly, if you're at the age of 66, counseling with your doctor, or certainly if you have a cardiologist already, you should definitely consult your cardiologist. But consulting your doctor beforehand is appropriate to review how you're feeling, what you've done in the past, what limitations you may have, and then they can kind of recommend any appropriate screening, which, you know, when you get to be 66, it's the rare person who has absolutely no risk factors. And so that, especially if you're going to be, you intend to do any degree of relatively moderate to high, especially high intensity exercise would be appropriate. Certainly, you know, low level or even moderate level physical activity, you know, which would include, you know, brisk walking, you know, things of that sort, which the American Heart Association recommends, don't necessarily need that type of, you know, screening per se. But I guess one thing I would say just to begin with is, you know, start slow and gradually increase. You know, you don't want to, you don't want to get injured and start back, but you also don't want to get frustrated and, you know, decide to throw in the towel because, you know, you can't do what you set out to do. That's one problem many people have. They set their goals too high and don't give themselves time to work up to them.
Right. Thank you very much, Dr. Heffron, for your fantastic talk, and I really appreciate you joining us again, and we'll look forward to having you back in a few weeks or months.
Sure, my pleasure. Thanks.
Okay, to Dr. Sokolov. I think one of the things that Dr. Heffron just said, which I just want to endorse, is don't shock and surprise your body. You know, you get this idea, I'm going to start exercising. That doesn't mean you suddenly try to exercise like you did 10 or 20 or 30 years ago. It's really important to start slow and to do it with and in conjunction and consultation with a healthcare provider, just so that you can be safe and you're not going to get injured and you're not going to be a shock to your cardiovascular system. So here's two questions I've got for you. Does yoga count as exercise? I've got a person here who says, I'm doing 5 yoga classes a week. Dr. Sokolov, what do you say? Is it aerobic or isn't it?
It can be. It depends on the style of yoga that you're doing. Absolutely. I'm a firm believer in yoga. A lot of my patients do it. There are some good clinical studies that have been shown to have beneficial impact. Mostly from a strengthening perspective and a flexibility, mobility perspective. It usually tends not to be an aerobic type of exercise, although again, it can be in certain instances. But I would say, my recommendation would be to supplement that with some form of aerobic exercise, whether it's brisk walking or what have you. And if you're not doing that now, certainly consult with your physician before engaging in any type of higher intensity. But you could start with just light or brisk walking right now.
I think I think what's important for people to realize, for most people, yoga is flexibility, and certainly it comes with the stress management aspect of it. It increases the parasympathetic nervous system, decreases the sympathetic nervous system. And, there are people who believe that if you do this Bikram yoga and you do yoga at very high temperatures, you can make it aerobic, but that certainly is not for everybody and should definitely not be done without consulting a physician. I certainly don't recommend that to people unless you're very young and you can tolerate that, because that is a stress to the cardiovascular system. So I've got a question for you about just a clinical question. You mentioned a vaccine and how you can boost your response if you exercise. Would you ever tell a patient, why don't you go and do a half an hour of exercise before you get your flu shot or your pneumovax?
Yeah, I might. I mean, the data does support it. If they were exercising to begin with, yeah, I wouldn't be opposed to that. I might try it myself.
Yeah, because it's interesting. I mean, we can't really prove that. I mean, there is this idea, but we don't know if it's going to make a difference long term. Now, you mentioned, which is something we all kind of worry about. The people who don't want to exercise love what you said about people who over-exercise. That means you shouldn't exercise. Do we know that marathon runners actually get, kind of age earlier? I mean, vigorous exercise like that, there are many studies that have shown that it can affect the cardiovascular system adversely, and certainly your joints. But for many of those people, it's a real, it becomes an addiction, because the endorphins go up so high that, people who do marathons absolutely love it. And it's devastating when they can't do it for one or other reason. Do you think we've got the evidence to say, it's not really a healthy thing to do? Now, we're not just talking marathons, very vigorous exercise.
Yeah, I'm not sure if we have the evidence, to say that it's not something someone should do. But there's probably good evidence on the frequency, of marathon running. How many marathons in a given year, for example. I'm sure there's probably a limit, and there's a lot of factors that will play into that too. Genetic factors, premorbid factors. Other diseases that the individual may have. So various other lifestyle factors. But that would be really interesting to, I know that they are currently investigating that, but I can't think that I know for sure.
Thank you. To come back to the issue of your immune system and cancer, you mentioned there's 6 cancers that have been shown to actually have a reduction in their incidence if you're regular exercise. Do you have to exercise for a long time to have that effect? Is it over years? Is it months? And why not all cancers? I mean, maybe not everyone, but is it just that we've got studies in certain cancers? What makes those cancers more likely to have a reduction?
Well, the cancers that have been shown, the exercise has been shown to actually be preventative are more common types of cancers. So those are the ones I think have been more rigorously studied. You will have beneficial effects on your immune system and its ability to combat cancer, really with exercising really at any time point. There's going to be that enhanced effect. There's probably a greater effect if you've been exercising longer, I would think, but I don't know if that has been specifically investigated. But that effect can happen really at any time point. So if you did not exercise before a diagnosis of cancer and started exercising after the diagnosis, you will still have that effect, that greater improved survival, for example. Yeah. We have 3 different types of cancers. It's colon, prostate, and breast cancer. We know that. And those are just the ones that have been more rigorously studied. More data will be coming out, I'm sure, within the next few years.
There's a question about any way to reverse cardiovascular disease with exercise. You heard from Dr. Heffron, and I'm on the same page, and you clearly reduce your cardiovascular risk with exercise, both if you've had a cardiac event and in prevention, for all the reasons that have been discussed today. The sooner you start exercising, if you don't, the better for you. We've shown it in multiple studies. It's very, very, very important to exercise and do something. Start slow. Be moderate about it. The beauty of it, of all these studies, that show that we get the benefit, right, Dr. Sokolov, with moderate exercise.
Right.
You don't have to overdo it. The maximum benefits are actually in people who are doing moderate exercise. So just 30 minutes of exercise once a day. Do you tell people that have maybe difficulties from musculoskeletal standpoint to try to make you break it up to 15 minutes twice a day? What do you do if people ask, can I split it?
Yeah, so I recommend that my patients do at least 10 minutes of sustained moderate intensity aerobic exercise at a time, but certainly they can break that up to get that cumulative 30 minutes for the day. So they can do 10, 10, 10, 10, and 10, or they can do 15 and 15. But I do try to encourage them to at least do 10 minutes of sustained.
Okay. Thank you very, very much. I just want to tell our audience that you do see patients, and that you have an office. Your primary expertise is in patients who've had cancer, and helping them to exercise and to rehab from all the lifestyle standpoints, all the lifestyle changes, and you focus on that. And I really, really appreciate that you're right in the heart of what we're doing in our prevention program, which is to help people prevent things happening. And even if you've had something bad happen, what you want to do is to prevent things getting worse or recurrence or happening again. So what's your phone number for your office? And you can end off with that. And maybe you've got a website.
Sure. The phone number, the best number would be to call 646-501-7723. And you can Google me, and the first thing that comes up will be my webpage at NYU.
Okay. So with that, I want to thank everybody for joining us today. Please give us feedback, because we're trying to find out whether this is a good time for you. Do you prefer to have these sessions during the midday, or should we stick to the 5 or 6 o'clock time? There's our email down there, hearthealth@nyulangone.org. Be in touch with us if you've got other topics you'd like us to talk about, or when you think the best time is during the week. We'd love to hear from you. Dr. Sokolov, Dr. Heffron, thank you so much. And of course, thank you, Anya and Michelle. And I look forward to bringing you the information as to when our winter series is going to begin. And as I said in the beginning, we have some great topics, and we look forward to seeing you next time. Thank you.
Thank you very much.